let's put 2 minutes on the clock and your time starts now. All right, so case number 2, let's look at those answers. I always try and get a few of these kind of women's health questions in early into the exam prep because I want you to identify quickly, is this an area that you need to do a bit more study, a bit more work in? It's something that I think a lot of GPs, a lot of male GPs in particular, might need more effort in, shall we say, to get through the exam. And so I'd rather we flag this early and make sure you know your strengths and your weak spots. Now, there's always going to be an abnormal uterine bleeding or vaginal discharge type question. It's just one of those almost given kind of things, so prepare for it. Know what you should be looking out for. And so what are our 3 specific differential diagnoses here that we are looking for? Trichomoniasis with that kind of history, it's the most likely, it's a probability diagnosis there. But of course, you can't really differentiate at this stage. So the other things we would be looking for would be bacterial vaginosis, vulvovaginal candidiasis, chlamydia, Neisseria gonorrhea, cervical ectropion or polyps, malignancy, less likely but not impossible, and fistula as well. Again, less likely, not impossible. If you aren't familiar with the Australian STI management guidelines for use in primary care, it is the Bible for STDs and STIs. Just go check it out, read it. It's a fantastic resource that I hope everyone's familiar with. Let's have a look through the chat, of course. Because here we have from Demir, vaginal candidiasis, fantastic, acute gonorrhea, vaginitis. Pardon me. Yep, fantastic. Yep, gonococcal infection. From Dr. Babar, we have gonorrhea, bacterial vaginitis, and trichomoniasis. Fantastic. Good. So you can say trichomoniasis. Otherwise, trichomonas, you would probably need to specify trichomonas infection. I know it's, again, pedantic kind of things, but these are things that kind of catch people out. And now is the time to find this out as well. But all fantastic answers there. Of course, we've got a question 2 for this case. So let's have a look. 2 minutes on the clock. And your time starts now. time is up. Let's get to those answers. So what investigations are we going to do? Again, this is taken directly from Australian STI Management Guidelines. We're going to be doing either a endocervical swab or self-collected vaginal swab, or it should be high vaginal swab, for Neisseria gonorrhea nucleic acid amplification test. Same thing for trachomatis. Same thing with or without first pass urine for trichomonas. A urine microscopy culture and sensitivity would also be 2 marks. High vaginal swab testing for microscopy and gram stain, 2 marks. Whiff test, less commonly these days, but it's still part of workup. And to be honest, the evidence for it depends on which source you go to. Is a bit touch and go. Really, you need to be adding the right reagents at the spot. It is an accepted mark, but it's probably not something we tend to do as much in clinical practice these days. And of course, you can do high vaginal swab pH testing, which would still be definitely worth doing and worth a mark as well. pH over 4.5 indicates bacterial vaginosis. Let's have a look at the chat then. We have here high vaginal swab for gonorrhea PCR. Be careful using, I know, I'm sorry. Be careful using PCR. You can use polymerase chain reaction, or really these days the test is nucleic acid amplification test. High vaginal swab for trichomonas, again, perfect, fantastic. Urine microscopy, fantastic. Culture and sensitivities. Yes, yep, beautiful. Love those answers. You probably need one more though, because we've got the gonorrhea, we've got the trichomonas, urine microscopy, culture and sensitivities is probably all lumped into that one answer, given it's ordered as one test. So opportunity for another response in there. And from Demir, we have high vaginal swab, trichomonas PCR. Again, spelling that out. HVS chlamydia PCR. You're getting lazy, man. You know, you should be writing it out. That's all right. And gonorrhea, you've got the same thing there. And microscopy for Candida. Yep, fantastic. Good. Again, probably need to expand that out because we have the option for 4 specific investigations there. But of course, we have another question here. So let's get another 2 minutes on the clock and your time starts now. All right, so let's get to those answers. So we've confirmed here, yes, we're dealing with trichomoniasis. We need to know what are we going to do about it. So while we tend to see some of this stuff more so in AKT in terms of knowing organism versus treatment, here we want to apply it to this specific patient condition. And this is an interesting one because it really depends on which guidelines you're used to using, because we actually have the 2 options here. We have oral metronidazole, which you don't need to know doses, but for your own information, 400 milligrams orally with food twice a day for 7 days, or 2 gram orally with food as a stat single dose. Or you can use oral tinidazole, 2 gram orally as a single stat dose as well. Which one you would choose to do, I think, would be based on patient preference, patient condition, compliance, risk of compliance concerns, and local guidance as well. If you happen to know what the local microbiome is doing, it may sway your answer. So if you were to go with therapeutic guidelines, which tends to be the kind of gold standard most people follow, you'd have the option of either or. If you're going just by Australian STI management guidelines, really it just pushes the metronidazole. So there you go. Let's have a look at the chat here. So we have 2 gram of Zithro. Will kill pretty much everything else we deal with in terms of STIs, but unfortunately won't do the trick for trike. Good guess though. And here we've got oral metronidazole, 2 gram as a single dose. Fantastic. Love that one there. Excellent. And sneaking in there from Nita, metronidazole. Fantastic. Very good. And for this one, again, if you want to be really nitpicky, specify oral metronidazole because it can be given in different formulations as well. I mean, let's be honest, we're only going to be using it as oral for this patient here. But if you just want to make sure you cover every base and get as many marks as possible,